Good evening, today is June 9th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that as cities and countries ease restrictions, public health experts are embracing the idea of harm reduction to help people lower their risk of infection while still living a full life, something that I've talked about in one of my previous videos. There are 5 rules to guide you in making the best decisions for yourself, and the first one is to track your area's health status. You want to know the percentage of positive tests in your community or state, and if the rate stays at 5% or lower for 2 weeks, there's mostly enough testing taking place to control the spread of the virus, and you can possibly just go out more and still be mindful to use social distance. But if the rate is higher than 5%, then it may show that there is still a coronavirus outbreak happening in your area. You should also limit close contacts, as the safest interactions are with your members of your household, but if you want to widen your circle, the key is consistency, and you could consider forming a quarantine pod in which 2 or 3 households agree on safety precautions and socialize only with each other. The third rule is to manage your exposure and think of your activities like items on a budget. Try to make trade-offs, balancing higher risk events and interactions like a dinner party with low-risk ones like grocery shopping, which are essential. You should also keep your riskier activities short, and these include how many people are going to be in this activity, if it's indoors or outdoors, as the indoors is more dangerous, and try to keep indoor events to under an hour and always wear a mask during close conversations. The last rule is to never let your guard down, and the advice we'd heard time and time again still applies. Practice social distancing, wash your hands often, and be extra cautious if you or someone in your circle is high risk and vulnerable to the disease. And if you follow these 5 rules, I think it should really be helpful. But just keep in mind, don't ever forget to social distance and wear a mask, as that is the only way it can actually be helping. The second thing that I'd like to talk about is that the coronavirus outbreak is spreading rapidly in Latin America and the Caribbean, also surging in countries that have taken early isolation measures like Peru, but also in countries where the government chose to ignore the virus, such as Brazil. So many countries have been forced to choose between citizens dying of the virus or of hunger, and they're beginning to loosen lockdowns, trying to save the economy and give citizens food to eat. However, this has consequently led to huge infections spiking, and yet I feel like this is just a huge trade-off between either food or virus, and honestly, it does not look good at all, the situation. It's also frightening as we see many countries that have thought to be spared from the virus, such as Peru, and Egypt and the Middle East are also being hit extremely hard, and some of the countries have tried to take the advantage of the hot weather of the young population, but the virus has still devastated these countries, while it is moving away from the Western countries, where it has done a lot of damage in the United States and in Europe. So I think this shows that the virus reaching your country is not a matter of if it will, but a matter of when it will hit. And I think honestly, it will be worse if the virus hits in the summer, because right now there's not a lot of signs that shows that the virus is being spread by the hot weather during summer. And if you're going to have to stay at home during this intense heat, I think honestly it may be just too much, especially as the hot weather and countries that are being hit right now are mostly poor, low-income countries with many millions of people in poverty. That's it. Thank you for listening, and I hope you have a good day. Thank you.